Next, we're going to give you a demonstration of the complete COVID-19 rapid de-stress protocol, first using the auricular trauma protocol, followed by the calming and centering treatment. To prepare, I've set up the 6 ear needles with the plastic handles and the 6 body needles with the guide tubes and the purple chads in a small container, and I have my probe for our ear points. Once the model is in the proper position, lying down comfortably with her head supported and her legs supported, I will ask her to sit up so that I can access her ear and place those needles in first, then lay back down to place the 4 body needles and the 2 head needles. I will begin by placing the 6 auricular needles in the ear points that correspond to those locations for the auricular trauma protocol. The first one is the hypothalamus, which is identified by finding the antitragus and descending along the inner wall of the antitragus down to the inner concha, the inferior concha.
Okay.
Right there. I'll take the guide tube with my needle and place it in the little depression I made with the probe once I identified the point, secure it, and insert the needle. Next, I will identify the amygdala, which is just below the cartilage of the intertragic notch along the fleshy part of the lobe.
Okay.
There. I'll secure that. And place that needle in. The third point is the hippocampus, which is just below the antitragus as it attaches with the fleshy part of the lobe. Right there, maybe?
Okay.
Okay. I'm going to secure that guide tube, tap the needle in. Next, I'll find the master cerebral between the lobe and the cheek.
Okay.
Sometimes it's helpful to give a slight twist to secure the needles once they're in place. That shows that it grabs nicely. The fourth point I will needle is point 0. This is where the root of the helix descends in between the superior and inferior concha. One, 2, or 3.
Okay.
And finally, we will place in Shen Men, which is located up at the triangular fossa.
Okay.
There we have the 6 needles for the auricular trauma protocol. Once this occurs, I can have her lay down, and then we could proceed to the body points. For the second part of the COVID-19 rapid de-stress protocol, we will place our 4 body points and our 2 head points, beginning with the points in the hand we described as large intestine 4. For this, I will take the chad out of the guide tube and hold the needle and chad and guide tube in place. I'll palpate for the muscle in between the first and second metacarpal. If I find a nice mound, securing my guide tube, pressing, removing the guide tube, then advance a millimeter, turn, advance another millimeter, and I feel a difference and get a confirmation from my patient that I'm in the right location. These should be placed bilateral. So once I place it on the left, I'll move to the right. Find the same interosseous muscle space.
Up.
Okay, thank you. Now on to the feet. At the point between the first and second metatarsal is the point we refer to as liver 3. As proximal as you can get in that interosseous space where it's still muscular feeling.
Okay. Okay.
She gets that right away. Good. And on her right side.
Okay.
Now I can come up to the 2 head points. We'll begin with governor vessel 24.5 in the glabella, in between the eyebrows. I will place the needle and angle it at a 45 as we mentioned. Tap and advance briefly so it holds itself up near the bone. And finally, I will come up to governor vessel 20, where I take the apex of the lobe of the ear all the way back to the midline and palpate for a nice divot. And this would also be angled 45 degrees posteriorly or anteriorly or flat. So there you have the calming and centering, body and head points, and the 6 auricular points for all 12 of the needles that are part of the COVID-19 rapid de-stress protocol.